For those of you that don't know me, my name is Krista Huff. I'm the director at the Down Syndrome Association of Greater Toledo. I'm so glad you guys could join us today. As many of you probably know, April is Autism Awareness Month, and I really wanted to do something and bring you guys some sort of informational presentation surrounding Down syndrome and autism, since I know we have a lot of families that have children with both of those diagnoses. And also a lot of families that, might, feel like maybe something's a little off and want to learn more. And possibly their child also has an autism diagnosis. So we're really excited to bring Dr. Danielle DeLong with us today, who's going to share a little bit about, some of the common signs of an autism diagnosis, and then usually, what next steps a family might take in getting an evaluation and some local resources and things of that nature. So if you guys have any questions, feel free to, you can put them in the chat, and hopefully we'll have time at the end to get to those. I'm also going to put my email in there in case you think of something later. I'd be happy to get the answer for you and, get Danielle to answer those. And then my last thing is, if you haven't seen yet, we do have a new Facebook group for parents with both of the Down syndrome and autism diagnosis. So really just a safe place for you guys to connect with other families who are going along that same journey as you, sharing resources, asking questions, and I hope to continue to post things in there that would be helpful to you guys as well. So that's it for me. I'm going to pass it over to Danielle, who can introduce herself a little bit more and get started.
Well, I am Danielle DeLong. I'm a psychologist and a board certified behavior analyst. So my primary area of practice is diagnostics, but I'm also certified in applied behavior analysis treatments, which we'll talk about a little bit later. My professional role is Director of Psychology Services at Harbor. I have been in the Toledo area for 12 years now, having trained and practiced in Pennsylvania for a short time, and then moving here to become just a line psychologist at Harbor. And 12 years later, I am still in this area. I love the Toledo area. I have a significant passion for expansion of services for service of families here, because when I moved here 12 years ago, starting my family and having a son, recognizing that rates of a number of things, including autism, are greater or more likely, it seems, in our boys, I remember looking at my spouse and saying, wow, I think we're going to have to move if anything is needed in terms of treatment or additional care for our child, because there's nothing here. 12 years ago, it was really hard to find services for a number of things. There weren't many specialty clinics. Diagnostics were really hard to find. And so it made me really aware that not everybody lives in an area where, right, there's treatment, there's identification services and things of that nature, which I think is vitally important. So over the last more than a decade, my focus at Harbor and within the area has been to expand services for diagnostics of all children, but particularly of very young children, and then to expand services for individuals with developmental disabilities, including autism or other related disorders. We find that finding behavioral treatment providers is really challenging, especially for our young children. And so that has been the focus. So in addition to being at Harbor, I have served as one of the chairs and then officers now. I'm the engagement coordinator for the Autism Provider Network of Northwest Ohio. For short, we call it APN. It's a really great group of providers who are seeking to also expand service, collaborate in development of service to bring our area additional supports. There's never going to be enough support for any of our children. And I think that most of you probably experience that. More support seems to always be better, as long as we're bringing quality supports to the area. But what we found in the Toledo area specifically is collaboration like this is key. So I'm really appreciative of being here today. So Krista, you had asked me to talk a little bit about autism identification, autism signs. If questions pop up in the chat, I can probably try to answer those while I speak. If it seems like it'll flow into something later, I can go ahead and address it at that time. So autism, I think we have a lot of awareness, and awareness is part of understanding. And so what I've noticed as a trend over the last more than a decade is in this area, I continue to identify individuals with autism and diagnose individuals with autism into their teenage years. Signs were observed very early on, and for any number of reasons, an evaluation was never completed. And this last year, with the pandemic, with individuals spending, I think, more time with their children and supporting them as parents, as teachers, as caregivers, in every single way, wearing every single hat, I think that a lot of families in this last year really started working with their child in a different way and seeking evaluation. And that led to us identifying teenagers with autism, which is great. I can say that in the first 4 to 5 years of practice here in the Toledo area, I most often was diagnosing children with autism at about 6 years of age, which is really late in development. Identification of autism earlier and earlier is the best scenario. Obviously, whenever we can identify it, that's when we want to identify it, but earlier is better in terms of developmental diagnoses, because then we can treat what we're seeing. And so one of the big misnomers, I think, with diagnosis of anything, but particularly autism, is you have to wait till 3. I'm sure some of you have heard that. And you have to wait till 3. You got to wait until we can see if they can go to preschool, or we have to wait until this, or, oh no, they all learn in their own timeline. And what we know from the CDC is not just that the rates have increased, but that the timeline from parent first reporting to concern to evaluation and eventual diagnosis for a number of early childhood disorders, but especially autism, can be 13 to 15 months. And I just think that's a really long time in that really critical period of development. As a parent, how I've correlated it, and then as a professional as well, is if my child had a medical disorder, cancer, type 1 diabetes, anything like that, I can't imagine waiting a year to learn about it. I find it very critical that all of the developmental disorders are identified early on. I don't know if someone can mute their microphone, that'd be great. There we go. We need to very early identify diagnoses and address concerns that parents have as the expert in their children so that we can treat them. I think in the Down syndrome community, we do see a lot of comorbid diagnosing of autism. I'm not sure on the updated rates, but I know that they can be significant depending on level of cognitive functioning and other factors. It can be a little bit tricky getting a referral for testing for autism when there's already a co-occurring condition as well. Very often the providers we see who are addressing the intellectual disability or genetic disorder in the scenario, so that's just this. You kind of bring your concerns as the parent and, well, that just comes with the territory, or that's just this, everything, you know, everything else will fall into place. Or if we wait a little bit longer, or we do a little bit more of this, we'll get what we need. And I always tell parents, the second you're concerned, it's okay to seek evaluation. With autism in particular, we can start evaluating in a really formal sense by 12 months of age. Sometimes we can't diagnose at that age because we need to see a little bit more skill development in certain areas to have clarity, but we can begin identifying that as early as 12 months of age. And as an evaluator, as a psychologist, if you have a concern that's beyond what you're already aware of in your child, that you think might be beyond a diagnosis of Down syndrome, I can start talking with you about that before your child is 1 year of age. And I think that's important for parents to feel empowered to seek out evaluators to answer those questions early, because the birth to 6 year period of development is the most critical. The brain grow, 90% of brain growth and development happens by the time we're 6, and we're able to make the greatest changes early on. So earlier is better, but if you come to realization of concerns later, that's still a good time to seek diagnosis. So we're talking a lot about age of diagnosis, mainly because that's really a hinge point in this area. We have seen a shift of younger identification. I do think that whenever there's another primary diagnosis, such as Down syndrome, we're probably diagnosing a little bit later in the trend. just because of the complexity of something like Down syndrome, right? Very often there are medical disorders, cardiology concerns. There's a number of appointments, right? And diagnostics is one more appointment, and it's very overwhelming. Very often, we're going to make confirmation of diagnosis for individuals with this comorbid presentation closer to adolescence, because the socialization impairments may not become as pronounced until then. And so with autism diagnostically, we're not just looking for a language delay or a social delay or certain specific behaviors. We're really looking for persistent deficits in social communication and interaction across a number of contexts. And sometimes that's really hard to distinguish when we have a comorbid diagnosis. We're also looking for restricted, repetitive patterns of behavior and interests. And in both of these areas, both the socialization impairment and the behavioral impairment, we need to be confident that it's beyond what we would expect given an intellectual disability or another disorder. So we would need to evaluate comprehensively to determine that these core characteristics of autism present beyond expectation for somebody's level of cognitive functioning or other diagnosis, which is a lot of technical jargon to say individuals with Down syndrome are going to have difficulties in certain areas, including communication skills and social communication, and they may have some unique behaviors that are persistent or repetitive in nature. What my job as an evaluator to do is determine, is that just explained by Down syndrome or intellectual disability or this other developmental delay, or is it also explained by autism? So some of the questions in the chat right now, do you identify people with Down syndrome who are in their mid-20s with autism? Personally, I have not. Typically, the socialization impairment is going to present much sooner. Keeping in mind, autism is really a disorder of that socialization, that fluid socialization. And often individuals with Down syndrome, while their socialization may not be consistent with peers, it's not wholly impaired. And so very often what we see in somebody with Down syndrome is we compare them to somebody their age. They may not have a lot of peers their age over time, but they are interested in socialization. They seek out socialization and they seek to interact and develop play at their developmental level. So we want to see that. So we're not trying to compare them to a base of individuals whose developmental level is significantly higher. The ways we do that are really working with the family, talking with the family, doing some direct observation as well. But it is possible to diagnose somebody into their 20s with autism and comorbid Down syndrome. I would say that's more rare, but it is possible. And we have diagnosed individuals across the board with autism into adulthood. Most recently, I would say in this last year, we've probably identified at least a half dozen or more individuals who are around 15 to 17 with autism who are otherwise unidentified. I would say that number in my clinic, where we evaluate over 200 individuals a year for any number of pediatric and adult diagnoses, I would say that that's actually pretty high. I think having individuals at home resulted in parent observation at a greater level and resulted in some really good referral for evaluation. Another question is regarding the challenge to get someone diagnosed. Is that true? So told since your son was 18, it would be hard to get them diagnosed. It is harder to diagnose somebody as they are into adulthood. It is harder to diagnose autism, particularly if there's a comorbid intellectual or developmental disability. However, I think what makes an evaluation for someone in that circumstance possible is if you have history of evaluation. Chances are you might have an evaluation team report, so an ETR that your school has completed for an IEP. Typically on the ETR, there's going to be really great evaluation data prior to 18. 18 is an interesting age mark that a lot of providers throw out there. Like, well, after 18, we can't this, we can't that. That is true for some diagnoses. So we need to identify somebody's IQ, intellectual quotient, or cognitive functioning prior to 18. Because in order to diagnose autism, you have to do many components in an evaluation. So what I need to do in an evaluation is a cognitive functioning assessment. So I need to get somebody's IQ. I need to have an understanding of what they're able to reason and how they're able to process information. I also need to determine their level of language. So typically I'm going to want to see a speech evaluation, particularly for an older individual. For younger individuals, if they're nonverbal, that's a very clear understanding that there's a language delay. Or if they aren't sufficiently verbal or fluently verbal, I can infer that there would be a delay. However, for older individuals, in addition to the cognitive functioning evaluation, I'm going to want to see a speech therapy evaluation. So diagnosis of autism, we're going to do a cognitive functioning evaluation, a speech evaluation, comprehensive developmental assessment. We typically use a measure called the Vineland-3. You can use it throughout the lifespan. So I love using it because we can see when you're 2, where's your developmental functioning? And when you're 22, where's your developmental functioning? When you're 90, where's your functioning? It's a really great measure to use throughout the lifespan. And then the fourth component I like to use is the ADOS. For those of you who have sought autism evaluation, you've probably heard that term thrown around too. ADOS, what's it stand for, right? It's this big magic evaluation component. It stands for Autism Diagnostic Observation Schedule. It is an interactive assessment that is considered the gold standard evaluation for autism. Alone, it should not be used just to diagnose autism because it's what I would consider a subjective objective measure, and that it's objective to a point. We know what we're looking for, and you get some guidance on it in terms of, as an evaluator, are you leaning more toward autism or not? But alone, it should not be used as just the sole measure. You really do need to complete all of these components to have a competent diagnostic evaluation for autism. This allows you to look at cognitive functioning and see if someone's symptoms could just be explained by their cognitive functioning, which can happen, or if there are other factors and facets that contribute to the diagnosis. That's why 18 is tricky, because after 18, I can do an IQ test, I can do a cognitive functioning assessment, but the standard is that any cognitive functioning assessment after 18 really it's not going to hold water. It gives us an estimate, but prior to 18 is the marker. It's a practice standard of care. And so that's where it does get a little bit tricky. But as an evaluator, I would say if you have a child with Down syndrome, you've likely had those assessments completed through school. And I can use those older evaluations as well as the additional treatment or evaluation components I need to make a competent diagnosis. So there's a lot of information out there that I think gets confusing, right? We're almost 20 minutes in and I probably said a lot of information that's super overwhelming. And so much of that comes from the experience of just realizing sometimes we hear things from other practitioners outside diagnostics. So I would say I'm a psychologist and I work almost exclusively in diagnostics and then mental health and ABA treatment. My entire universe kind of exists in this care of individuals with autism, individuals with pediatric diagnoses, and then diagnosing people throughout the lifespan. And the biggest confusing factors are, how old do I have to be when I get diagnosed? And how old what's the oldest age limit for diagnostics? And really, we can diagnose extremely young. And if a parent's concerned before 12 months of age, call an evaluator. I think that's really great. And then after 18, there are definitely ways to competently evaluate. And there are a number of providers within my own agency and in the community that evaluate adults. And it's really important to identify autism because we want to make sure somebody's needs are met in a global sense. We also want to have understanding. As a parent, I think whenever there's something going on with your child that just doesn't seem to settle right with you, right? You just get that feeling as a parent. I always tell parents, follow your gut. Even if the answer at the end is everything's fine, you know what, you've resolved it. And I think that's really important because we need to make sure we're doing everything to support our children. But then also as a parent, when we have a concern, it's important to go to the right place to get the answer. And I always encourage families, if you're not sure, call. Worst case scenario is I say, I think we can wait, or let's do this. But you're the expert on your child, or your providers want to support you in that. So we talked a lot about diagnosing. So how do you get diagnosed? So there are several clinics in the area, I would say, that conduct autism evaluations in particular, since that's what we're discussing. And any evaluator who is going to evaluate for autism is most of the time going to also look at a really comprehensive assessment to rule out other diagnoses that could explain your symptoms. So very often individuals come to me looking for an autism diagnosis, and I say, okay, hold on. Based on what you've told me, I also need to look at, anxiety. I need to look at cognitive functioning level. I need to look at learning difficulties. There are a lot of things that overlap in pediatric diagnoses, just like adults. So in the adults zone, when we're thinking about adult diagnoses, depression and anxiety can overlap. The symptoms can sometimes look the same. So we have to do what we call a differential diagnosis. So you want to go somewhere that's going to do a comprehensive evaluation. Harbor offers those evaluations at multiple locations, depending on age and location of the client. So my location, I am located at our Port Sylvania building, which is also where our ABA clinic is, which we'll talk about in a little bit after we talk about diagnostics. We have several evaluators here. We do team evaluations. We get multiple eyes on children. We do that multifaceted evaluation where we're doing the IQ assessment, the ADOS assessment, and the developmental assessment, while also gaining speech evaluation information as appropriate. Harbor also has a location downtown, and I can make sure, Krista, I send you one of the resource lists that I have at the end. We have a location downtown as well, where they're going to do autism evaluations, as well as evaluations for other pediatric diagnoses. Sometimes you might not be worried about autism or concerned for that, but you kind of think something isn't adding up. You understand Down syndrome, but you want to see where your child's functioning. If there's something else going on, whether it's anxiety or depression, which is also often overlooked in individuals who have developmental delays or intellectual disabilities. Anxiety and depression still happen, and I would say they're under-identified. I don't have rates, but we know that I think in our communities that we're not always recognizing those concerns in individuals with autism, with Down syndrome, with other developmental delays, and that's important to evaluate as well. So Harbor offers those evaluations. I will make sure Krista gets the information to contact me. I believe Mercy still is offering evaluations. I see Alexis Eggenberger, their manager of autism services, the director there. She might be able to provide information about where Mercy is evaluating. I called you out.
I know you did. Good thing I was sitting here. I oversee the diagnostic services at Mercy. We do still have our diagnostic clinic. We evaluate children 5 and younger. And our wait list right now is looking about 2 to 3 months out.
And I would say that's the biggest challenge, wait lists, right? So as well as being at Harbor for as long as I have, one of my core focuses has been eliminating wait lists. As a parent, I have this very extreme correlation. I recognize this is extreme, but this is what I think of as a parent when I'm concerned for my child. If it were cancer, would you make me wait? You wouldn't, right? I get right in, wouldn't I? Because it's so concerning. And to me, whenever any concern is happening with my child, it's serious and it feels very urgent. And so there are waits. I would say those waits also vary throughout the year. Beginning of the school year, end of the school year, we tend to get a lot more referrals. So Harbor evaluates throughout the lifespan. Mercy's going to evaluate that really critical age period, which is fantastic. And what we usually, I think Alexis and I both tell people this, get on every wait list to get evaluated or treated everywhere you can in the area, because access is a challenge when you have so many individuals in a community. I believe there's also a couple of private providers who are evaluating, and University of Toledo may also currently have an autism evaluator, but they can be contacted at their Kobecker Center to inquire. So those, and I would say throughout my time here in the Toledo area, the number of diagnosticians has not increased. People often check their insurance and find me, and on the insurance panels, it just says I'm a clinical psychologist. It doesn't say, hey, she specializes in autism and developmental delay diagnoses. It just says clinical psychologist. And so that can be challenging for families to find a provider as well. To access most of our services at these larger corporations, you're really just going to call and say, hey, I'm interested in getting an evaluation for my child. I think that they might have autism. At Harbor in particular, depending on your child's age or your family member's age, they're going to route you to a proper location for that. I would say that each building has a different wait list here, but I would say the 2 to 3 month wait is a good solid expectation here, which is really, really good. I would say Nationwide Children's is another kind of good comparison location. And I want to say sometimes when families who live south of Lima might call there and up here to get evaluated, when they call Nationwide, they're told, well, we might call you in a couple months to consider setting up your appointment, because they have a 12 to 18 month wait minimum. So wait lists are frustrating. So as a parent, I want you to try to get on every list you can. And, you know, if you are interested in getting tested, you know, at Harbor in particular, I can just speak for me, and you're unsure what's going on or how long you're gonna have to wait, you can call and ask to talk to me. And I'll take a peek and I'll say, this is what I think. I can't guarantee timeline. Tell me what's going on. You know, if there's a reasonable concern, or, you know, an IEP meeting coming up or something pending for which evaluation might be more emergent, we can help determine if we need to escalate your timeline. But in general, you can't expect to wait. So that's evaluation. We talked about symptoms, and we talked about age at any point in time. You know, my biggest thing is, you're the parents, you're the caregivers, don't wait. The second you're concerned, contact somebody who's an evaluator, who's at a clinic where they can help determine if evaluation is appropriate. You know, very often families come in here. I have a number of evaluators, 20 to 25 evaluators here, who do the initial appointments to get an initial understanding of what is needed to support somebody. Sometimes kiddo comes in super socially engaging, going back and forth, playing with us, pointing at things, showing us things. Yeah, there are some developmental delays, but they're so socially engaging, they don't have autism. We're not going to refer for evaluation for autism. Social engagement is really that crux. Even if social engagement is really positive with us in the office and you're not seeing it elsewhere, we're probably going to say, let's defer evaluation and do a couple more treatment things first to see if there's credence to evaluation, because we also, as evaluators, have to have what we call medical necessity. So to evaluate for autism, the medical necessity is significant impairment and, you know, social communication, social interaction, or at least enough concerns that say, this isn't developing quite right. And then we refer for evaluation. Again, at any time when you're in the course of seeking out evaluation or treatment, I'd say, if you have questions, ask your provider, call somebody like me, call Krista, try to get some help, because advocacy in the community that we live in is very important. And many of us are connected to other providers who, if we can't answer your question or if we can't help, we will link you with somebody who can. So a great resource is the Autism Society of Northwest Ohio. If you ever have just initial questions and you're unsure, where do I go? Is this reasonable? What should I do? You're going to want to call Kate Schwartz at ASNO. Their offices are actually in one of our suites here, and we find them a very valuable resource. Kate can help you navigate. What do I do now? Do I just need to contact the Board of Developmental Disabilities? Do I need to get an autism evaluation? You know, how can I access additional support and help? And very often for initial questions and exploring the autism question, Kate Schwartz at ASNO is a great resource. And she almost always answers her phone, or we'll get back to you. Actually, I was just texting with her earlier about an individual who's an adult who needed care. And I thought, well, I don't know who needs to help that person. I sent off a couple emails to a couple different people, and we found someone to help that person. So it's a really great community to get your needs met. And I would just say getting over that barrier to ask someone is really, you know, the biggest step. Any other questions before we move on to kind of talking more about treatment? Okay. So a lot of people wonder, okay, my child has Down syndrome, or my family member has Down syndrome. How are you going to be able to tell if they also have autism? I would say a competent evaluator is comprehensively trained in autism evaluation is also going to have already been trained in evaluation of other disorders. So, you know, when you come to me as a psychologist, I'm comprehensively trained to identify concerns throughout the lifespan. The key that is really tricky, I think, in diagnostics, being very transparent, is most people with Down syndrome tend to be gregariously social. That tends to be something we very commonly see in the Down syndrome community. If you're extremely social, overly social, or engaging with others, have a desire to engage with others, but maybe there are some challenges and difficulties in how you socialize, we're less likely to reach a diagnosis of autism. But I think that evaluation to answer that question is important, because through the course of evaluation for autism, we're going to learn so much about someone that helps them, regardless if we reach a diagnosis of autism. Because of the nature of how the evaluation works, that amount of information we learn, regardless of the conclusion, is vitally important. So sometimes I don't reach a diagnosis of autism after I'm evaluating somebody, but man, I know a lot more about that person, and I'm able to make recommendations to help. When we do reach a diagnosis of autism, because I do see that persistent deficit in social communication interaction, and I am seeing significant criteria to support the restrictive and repetitive behaviors beyond what we'd expect based on just intellectual disability or some other comorbid diagnosis, there are some specific recommendations for treatment that I'm going to make. When individuals are diagnosed with autism, what we know is early intensive behavioral intervention, EIBI, for short, is the most successful type of treatment. Traditionally, that's going to be provided through ABA, so applied behavior analysis. So when you Google ABA, you are going to get a lot of information about what it could look like. And I think as somebody who oversees an ABA clinic and has worked in the autism treatment field for a long time, I would say that ABA is very diverse and varied according to the needs of the individual. Sometimes people search ABA and they see somebody sitting at a table all day making choices. That's called discrete trial training. And it usually consumes a very small part of someone's day. We have to teach people how to make choices. So that is part of ABA. But very often I have families come in, they're concerned their child has autism. We reach a conclusion that it's autism, and I sit down and I start talking about the really effective treatments for autism that are behavioral in nature. And I say ABA, and immediately they say, no way, I'm not doing that. I Googled it, and I don't want my kid sitting at a table for 8 hours a day with an adult. And I go, oh no, that's not what ABA is. Our clinic is fun. It looks like a preschool. We're going to recommend 20 to 30 hours of ABA, including speech therapy, occupational therapies for individuals diagnosed with autism, particularly in the early ages. Typically, our clinics are for 2 to 5 or 2 to 7-year-olds, depending on functioning level. They are going to play. They're going to play. They're going to do some gross motor activities. They're going to learn their alphabet. They're going to learn to wash their hands with compliance. That's a really important one right now in this last year with the pandemic, washing hands a lot here. They're going to do circle time. They're going to learn to play with more than just their favorite toy. Very often with autism, right, we love a certain toy. I only want to play with dinosaurs, or I only want to play with trains, or I only want to line up my little people. And if I get them out of order, I'm really upset, right? But I'm going to arrange them, and I like it that way. We're going to play. We're going to help disrupt that order and grow a skill so that somebody can be collaborative and cooperative with peers. So in a really strong ABA clinic, you're going to see a number of different behavioral approaches. Incidental teaching, pivotal response training. Those are just a couple keywords. You're also going to see some discrete trial where your child does learn to sit for longer periods of time as we're preparing them for school, and they're going to learn to make a choice, or they're going to learn to identify their peers based on pictures and say their name, because that's really important. Not to just yell at somebody because you don't know their name, but to remember their name, or to be like, hey, you, if you can't. I've toured most of the autism clinics in the area, which I will list, I promise. And they're fun. They look like preschools. But the key is with ABA is we're using scientific methodology with the goal of improving skill. It's behavioral shaping, behavioral training. Some of the protocols I know that are going on in my clinic right now range from toilet training, very important, to feeding training, like eating your lunch in 15 minutes, because after 15 minutes, your attention decreases. because you might be 2. And we want to make sure you get enough food in your tummy and aren't distracted. Some of the protocols include playing with a train appropriately, but not laying on the floor and watching it move back and forth. Even though you're quiet and you're content, that's not how you play with a train. So there's a lot of different protocols, and we use assessments throughout the ABA treatment course to determine when you're ready for the next step and when you're ready to transition into a more what we would call neurotypical environment, such as preschool or kindergarten. In the Toledo area, the ABA clinics, particularly for young children, so more of that 2 to 5 or 2 to 7 years old, include Harbor's Clinic, which is housed here at our Port Sylvania location. So the Mercy Clinic, which is off of Briarfield Drive, Briarfield Boulevard, off of the Salisbury-Dussel exit of 475. So it's in the Maumee, Monclova Township area. Hope Bridge, also in Maumee in the Arrowhead Park. ProMedica's program is on Lawrence Avenue in more downtown or kind of by Detroit Bancroft area of Toledo. And then Gateway Pediatrics is the more recent ABA clinic or autism service provider, and they are located on Monroe Street, I believe. Most of these clinics are in-house. I think some of us try to do, I know Harbor, we have a pretty robust outpatient program, but in terms of the 20 to 30 hour a week programming, which is definitely what we need to provide to meet the research standard for improvement, these clinics are in-house school type setting. And there are wait lists, right? Waits. We talked about waits for diagnostics. There are waits for treatment. We are trying. And when I moved here, the only autism treatment provider in the area was Chip at Mercy. And I couldn't find a phone number for it because it was always so full that it was so hard to send families there because they might wait 18 to 24 months to get in. So we have come a long way. There's been a huge autism service initiative in Toledo, and now we have a number of providers. And our goal, of course, is always to keep expanding, to keep growing, to keep hiring staff to serve individuals. And I would say we've grown tenfold to what we were providing, a decade ago, and there's still wait. So what we typically tell each other is, or tell our families, put your child on every wait list. Families tour the centers, go take a look. You might have a top choice. I can tell you, I trust all of these treatment providers in the area. I think they're all really great people. I think they're well trained, board certified behavior analysts at each location, which is the standard you want to look for. We are certified to provide ABA services. We have master's degrees or equivalent credentialing in ABA, in applied behavior analysis. So BCBAs are at all of these locations. If Harbor calls you, but your first choice for any number of reasons was Mercy's Clinic, you can start at Harbor because you can get in, you might get in first, and you can keep your child on the wait list at Mercy. And when Alexis calls you and says, guess what, your wait is over, you know what, we transfer services right over. We're all pretty much using the same protocols. We might get to a resolution of a symptom in a different behavioral way, but the science is going to work the same. And we're using largely the same measures to determine the goals. There are lots of standards in our practice. And as BCBAs who coordinate with one another regularly and have a passion for supporting individuals in Toledo to get services for individuals with autism, we're going to make sure that we are supporting your child, your family member, however we can for a transition, whether that's to another provider because it just works better for you, or if that's to school. That's our ultimate goal. Traditional kindergarten, traditional first grade. So ABA is typically thought of as a full-time program for individuals from 2 to 7. Some of you are probably thinking, well, I'm concerned my child or my family member with Down syndrome has autism, but they're 9. Does that mean I can't get help? So we can still diagnose. And then there are other alternative treatments. Very often in that situation, we don't want to pull somebody from school. We can work with, outpatient treatment programs exist to work with you to develop interventions that will be successful for you in home. And then we can help transfer them to school. Sometimes you can get a treatment provider to help coordinate directly with the school. Of course, the tricky part with all of this can be insurance, but you can always call. You can call me. You can call Kate Schwartz. I'm sure, you know, if Mercy is your choice, or you're familiar with Alexis because of her fantastic work in the community, you can call Alexis and ask her, and we're all going to try to provide you with everything we can. Once children are in school, we do like that consistency for them if that's the best environment for them. So very often the question I get about school age individuals is, do I need a special school for autism? You know, you need your child or your family member in the environment that helps them to be the most successful. I'm going to say hands down, for newly diagnosed individuals between 2 and 6, 20 to 30 hours a week in an exclusive ABA clinic, period. That's what the research tells us, right? And if I were a medical doctor diagnosing a medical disorder, I'm going to say this is the treatment we do, right? This is the antibiotic we give. This is the chemo or whatever we give. For autism, from 2 to 6 years of age in particular, because the brain is growing rapidly, we want you in a full-time clinic. That would take the place of school in most situations for 20 to 30 hours a week. For school age individuals, it really depends, which is a hard answer, right? It depends. You probably hear that often. Working with an evaluator, they can, you know, somebody who does what I do can talk with you about what's going to be the best fit. Outpatient services might be the best fit if your child is growing at school and they're managing the behavior well. You know, we can work with you as a family to grow and develop other skills that would help supplement care. Sometimes individuals with dual diagnosis of Down syndrome and autism are not as well managed at school as would be ideal for that school to be the best fit. And that scenario, typically that's a bigger conversation, I would say, with the school district and with the family and potentially with an outside treatment professional to determine placement. There are specialist schools in the area. Autism Model School has a board certified behavior analyst at their school to help develop programming. There are other autism schools such as Goal and AAL. Those two do not currently have a BCBA on staff, but I don't know that that means they're not going to be the best fit for your child. It's really going to be from there determining what is the best fit. How can my child be most successful? And sometimes that question is hard to answer for individuals who are school age and already enrolled in school. So what I typically tell families to do is go do your research, go tour. Say, this is, you know, bring the IEP that your child has. This is my child's IEP. If you were providing service to my child, what would it look like here? Could you offer this? Could you offer that? I know my child needs more behavioral supports. What would that look like here? And then you can determine fit. But in terms of treatment for autism, we're going to say that is almost always going to occur outside of a school setting. Schools there to educate our students and to support them in the best way possible that they can. They're going to make behavior plans. They're going to provide speech therapy and occupational therapy. But in terms of autism treatment in the more scientific sense, we're going to recommend supplementing with outpatient services or other supports for treatment. So then adulthood, right? So we talked about the early childhood period and what we do there. We go to an ABA clinic full time if possible. And then we talked about school age. What about adults? And that's another, it depends. Some of our adults who have comorbid or co-occurring diagnoses of Down syndrome and autism reside at home, and families support them in accessing treatment. I would say very often outpatient services are going to be what you're looking at. Some individuals are involved in vocational rehabilitation programming, which you can access through linking with your local Board of Developmental Disabilities, who I think into adulthood is going to be your main collaborator for treatment. I would say ASNO would be another great resource. I know that in the adult autism community, for people who have looked into autism in adults in the Toledo area, kind of there's several names that come up typically, right? Sunshine, Ann Grady, and Bittersweet Farms. Those locations have really great programs for certain presentations. So they're not going to be places that treat everything autism in adulthood. They have residential options. There's a wait list for residential options, of course. But then they also offer very often summer programming or what they call day habilitation. Very often in the summer, that's a hard period of time to fill with activities. But we're typically going to recommend you work with your local county board of developmental disabilities to establish programming that is valuable and meaningful. I very often tell people when there's a 2-year-old in my office who I'm diagnosing with autism that I'm seeing them right now and I'm diagnosing their family member, their child, but I'm thinking 20 years in the future. It's really hard to think about in the moment. And as a mom, I get that, right? Well, it's so far. Well, it's important. So when I see a 2-year-old and I diagnose autism, I think about them when they're 22. Individuals with autism and other disorders very often have IEPs that allow them to remain in traditional education or education through their school district until 21 years of age, which is great. Get lots of vocational training, job training, linkage to services. But then what happens next? And very often I hear, well, they'll just live at home. Most 20-somethings don't want to just live at home. It doesn't matter what's going on. They want to go do what everybody else is doing. They want to go work or hang out with other people all day, be stimulated. It's really hard to stimulate an adult. As an adult who maybe is working full-time or not, I always challenge families to think about what would you think the most successful picture of your child's life would be. And for most of us, regardless of how we have to get there, that's our child doing something meaningful that they enjoy. And that might look different for somebody who has autism, who somebody has Down syndrome, or somebody who has Down syndrome and autism, but we can support these individuals in finding what really makes them tick, whether that's, a job in, I don't know, animal service industry, right? There's so many options there, a job in a technical construction field. Okay. So I always want families to be thinking about, when we're into our 20s, my role as a family member is seeking out treatment providers or other professionals who can help me ensure that we have a successful life full of opportunity, which can be a little bit more challenging to figure out. There's a different roadmap, but it's definitely something that we need to start working on once somebody is 2, once they're 10, when they're 16. And typically the Board of Developmental Disabilities will help with that. In terms of more clinical treatment, of course, there's a number of outpatient treatment providers who can help with things like just therapeutic engagement, whether it's talk therapy, cognitive behavioral therapy to help somebody process emotions and handle stressors and things like that. That is often sought, whether it's medication management, which may or may not be appropriate. Those are also services that you can seek outside of, the Board of Developmental Disabilities. So I have a couple questions. If our child is not diagnosed with autism after evaluation, can ABA therapy still assist in developmental delays to help meet child's goals? I love that question. So thank you so much for asking it. So what I say is behavioral treatment is effective for almost everybody. So before I was a BCBA, I was a psychologist who was a behaviorist. I could do cognitive behavioral therapy, which is more what people think about as like thinking, feeling therapy. But man, my brain just really ticks a little bit more like behavior. I see sequences, I see reinforcers and consequences. And I think that you can grow somebody's skills with behavioral methodology, regardless of diagnosis. A number of years ago at Harvard, we started something called the Intensive Behavior Treatment Program. And IBT, as I call it, was just for this scenario, where behavioral treatment is really what we needed. And we needed to do it on a level that was more than just talking about behavior. It was about collecting data, collecting information, and really using science to help everybody, parents, caregivers, teachers, treatment providers, understand the child's behavior to help make successful change. And so we use behavioral methodology for a number of diagnoses: developmental delays, intellectual disability, anxiety, OCD, defiance, any number of disorders. If we feel that behavioral approach is going to be appropriate, we use it. But I would say especially in the intellectual disability, developmental disability, or developmental delay population, it's very effective. And in that case, we're working with caregivers more often. Very often what's most appropriate isn't just talking with a child about, now, you're not supposed to do that. We want you to try harder to obey the rules. I want you to turn off the light when you leave the bathroom. I don't want you to hit Susie at recess. That's great. But if talking was going to work for many people, you as parents would be able to get it done. So absolutely, behavioral treatments are effective and appropriate for individuals of a number of presentations. I would say throughout the lifespan. Sometimes somebody with depression, even into adulthood, who maybe doesn't have a developmental delay or intellectual disability, they can't see their depression and they're very resistant. Well, sometimes behavioral methodology helps them see the things that were hard to talk about. And so we use behavioral intervention very often. And I would say at our clinic, our ABA providers do provide that service because they're multiply credentialed. The second part of that question was, is it common to only qualify for ABA therapy along with autism? Yes. ABA is only certified for treatment for autism. So this is a bit confusing. In order to bill ABA services, so part of this is an insurance thing, right? In order to bill ABA services, you have to have a diagnosis of autism. It's just how it is. And I would say insurance providers more recently also indicated that for their insurance plan, if you did not have an ADOS, that Autism Diagnostic Observation Schedule, right, that gold standard interactive subjective objective evaluation that we use to diagnose autism or help us diagnose autism, if you didn't have the ADOS, you can't access your ABA benefit. So ABA is exclusively, by definition, reserved for individuals with autism because the research suggests that it is effective for treatment of autism. However, most of us who are trained in applied behavior analysis are also trained in behaviorism, which is actually part of psychology and mental health treatment services. So there's kind of a twofold, response to that. Like, yes, ABA and autism go together, and it should be a really diverse program with a lot of different behavioral approaches. And then you can get behavioral treatment otherwise. All right. Krista, were there any other topics you felt like I needed to discuss that I didn't? I know we have some more questions in the chat too.
I think the other question would be, and I kind of know the answer just because I've seen it firsthand, but if you have a family who, I think it's a lot for them to already have a Down syndrome diagnosis. So I think it's overwhelming for them to think, oh my gosh, like another diagnosis of autism. Like, I think it's a scary journey to venture down. But what would you say, like, what would the benefits for that family be to seek out the evaluation and get that second diagnosis?
Absolutely. I think, obviously, as an evaluator, I think it's important to understand somebody's presentation. It helps us develop more effective treatment. And it is overwhelming. On the emotional side for the caregiver or the parent, I think answering that question is extremely important because you don't get to go back in time and have that question answered. Mm-hmm. And so on the parent end, I always say you never want to regret not looking into something because we can always do something in the moment. But for some things, particularly autism, the earlier the better. Certain disorders, obviously, you can't see them, right? You can't look at somebody and tell this is what's going on. I have a child with an invisible disorder too, and sometimes I get pretty frustrated about it because you can't tell that something's going on, right? And so autism can be kind of invisible to others, but the understanding that is gained from family members and the stress relieved with an answer, whether it is autism or isn't, is very important. Is there a benefit to diagnosing autism? I think this is kind of another two-part. Yes, we want to understand very clearly somebody's presentation. Sometimes people think there's a lot more that gets unlocked once they have an autism diagnosis. They're going to get more at school, they're going to get more here. That's not wholly true. Sometimes individuals are very successful in their environments, and an autism diagnosis is really just for diagnostic clarity and maybe some understanding of how we can develop different skills that may be stagnated. So I do think it's important. I don't think for many individuals, maybe who are higher functioning or who are otherwise doing well in their environments, it maybe is just a piece of understanding and they otherwise have their needs met. But I do think it's important because that does change the scope of the future. Because diagnostically, in terms of criteria, autism affects social interaction and reciprocal social interaction. As you grow into adulthood, the barriers increase, right? Look at us, we're all socially interacting right now. We're all socially interacting in our environments. And sometimes with supports at school, you might not notice that social interaction deficit or difficulty in someone. It becomes extremely apparent as they try to get their first job and work in other environments. And so I do think it's important just for long-term care that we have an understanding, because then we can start targeting that addressing it sometimes before, before the skill deficit becomes problematic. So a couple other quick questions here. So the question about where to go to get help. There's a number of different locations. Harbor offers an outpatient treatment program for many behavioral difficulties that occur at home. I know that our autism providers, our ABA providers, typically refer to us for more outpatient needs. We treat feeding difficulties, sleep difficulties, toilet training difficulties, these are like the trifecta of things that we as parents want done. We want our child to properly eliminate on the toilet. We want them to eat a good meal, and we want them to sleep well at night. Those are the most important things. And then from there, we work on behavioral concerns, such as noncompliance, task refusal, escape behaviors, aggressive behavior, acting out, anything like that, that we can address that here. I'm not sure, there are likely other providers in the area that are doing that, but in terms of this unique population, I would say our intensive behavior treatment program is likely going to be the best fit. Just to have it being a provider and trying to refer people out, that's what I've experienced. Common signs to look for in a baby or toddler. The CDC has a really great list, but in general, and these are signs, these wouldn't be symptom or criteria for the disorder, but delayed language, so no meaningful word, and you'd expect, we should see babbling, referencing their name, responding to their name, typically between 6 to 9 months. Typically by a year, children are pointing to things they want or things they like just because it's fun. Look, an airplane. We all do it when we're holding a baby, don't we? Look at this, look at that. An individual who doesn't respond to that or doesn't do that, for sure. Somebody who doesn't show interest in peekaboo or those social with children by about 7 to 9 months of age, I'm going to say that's a concern. No pretend by about 24 months. Baby playing with a baby doll like they're delicate, doing action figure things. So things like that. And I definitely do recommend to the autismsociety.org. It's autism-society.org site. It's their main national site, and they have really great documents on so I think that covers the bulk of the questions in the chat. Was there anything else? This has been really great. I know it's a lot of information, but I'm thankful to be able to provide it. Alexis, do you have anything to add? Anything I missed?
I would give you a plug all day long. Honestly, what I love about Northwest Ohio and our network is that, like Danielle said, we really do work together. And if I don't have an opening in my program, but she's got one in hers, I'm going to refer over. And we really do work collaboratively. I don't even consider us competitors. We're really a big team, and we're all here to help individuals with autism. So whatever we can do, we're happy to help.
Absolutely. Yes, that is a good summation. There's always going to be people who need support. And however we can support you and getting what you think your child needs, even if you think it's the moon, you know what, come ask me for the moon. I'll let you know what I can do, and we'll see how close we can get to the moon. But, I'm a parent, and I've done treatment. I've treated thousands of children. I'd love to get the moon for each of them. And so however we can come close to getting them exactly what they need to be the greatest success in their future is what we are all about doing. All right.
Well, thank you so much, Danielle. I really appreciate you taking time out of your day to share so much information. I will look out for some emails from you with some of those resource lists, and then I'll go ahead and share them with all of you on today's webinar, and then I'll share them in that autism Facebook page also that we have. So that way they're there. And then I'll also put a recording of this and those resources on our website, which is dsagt.org. So that way they'll be there for you guys. And then if you have other families that you know of that are, going through similar things that maybe couldn't make it today, you'll know where to direct them.
Thanks so much, everyone.
Thank you guys so much.
Bye.